All right, folks, so it's 4 o'clock, so we'll get started. This is the Oregon Speech Language Hearing Association live stream of telepractice questions and answers for you, provided by the Telepractice Advisory Committee. And we've also invited Erin Haig, who is our representative from the Oregon State Board of Examiners for speech language pathologists and audiologists. This is our very first time attempting this live stream concept, and so we are really grateful for you all joining us and sticking with us as we figure out some of the kinks as we get through this live stream together. This has been posted both on our OSHA YouTube page and on our OSHA Facebook page, and we will be recording this and we will post it after we are completed to our OSHA YouTube page for future reference. I'm Megan McGill. I am an assistant professor at Portland State University. I specialize in research related to telepractice and stuttering. And so that's my specific area. I am involved in the Telepractice Advisory Committee and have been for about a year now. I'm also going to take the time right now to introduce the other folks who are here with us today, who are part of the Telepractice Advisory Committee. I'll introduce you, and then if you would like to share a little bit about who you are and what your relationship is to telepractice. So we'll start with the advisory committee first, and then Erin, I'll have you introduce yourself last, and then we can move right into some licensure questions. So Jenny, would you like to introduce yourself?
Sure. I'm Jenny Petticord, and I am the clinical director for the Hello Clinic, which is a private practice based in Portland, Oregon, and it's the private practice portion of the Hello Foundation. I have worked for the Hello Foundation for about 12 years, and in addition to running the private practice portion of our business, I am newly our business development strategist. So learning a lot about the business of being a speech pathologist and the services that we provide across settings. I have been involved with the Telepractice Advisory Committee for also a year, which I think is about how long we've been doing this, but have been implementing telepractice into my clinical work for maybe 9 years. So a lot of the things that we're going to talk about today are things that we've seen change a lot over those years, and of course, certainly in the last 48 hours, things are changing rapidly.
Thanks, Jenny. Kira, would you like to introduce yourself next?
Sure. My name is Kira Wright. I also work for the Hello Foundation. However, I work on the schools side of our business. I'm an SLP, and I've provided a variety of telepractice related services in the schools over the last decade, but right now I supervise and support about 65 SLPs, OTs, and school psychologists that work for the Hello Foundation in schools across 4 states. And many of them are providing services through a hybrid model involving both on-site services and telepractice or telesupervision or teleconsultation, all kinds of services, and then a handful of placements that are direct telepractice. And I also provide services to some school districts in Eastern Oregon over streaming video.
Thanks, Kira. Emily, would you like to go next?
Hello, my name is Emily Quinn, and I'm an assistant professor at OHSU, and my background is in speech language pathology. I'm working in the Department of Pediatrics, and I have a research program that's focused on delivering early intervention to young children with neurodevelopmental disabilities using a hybrid model that incorporates telepractice, telehealth service delivery. And so I specialize in serving children in early childhood settings and mostly doing parent implemented early intervention. Excited to be here. Thanks for having me. And I've been involved with the advisory committee for about a year, and we're just really excited to help you and support you with answering your questions.
Erin, would you like to introduce yourself?
Well, greetings. I hope everybody's staying well out there. My name is Erin Haig. I'm the Executive Director of the Board of Examiners for Speech Language Pathology and Audiology in Oregon. I've been in the job about 5 years now, and my career is basically an administrator and fundraising, special events, grant writing, et cetera, for a number of nonprofits, all in health related things such as arthritis, psoriasis, et cetera. The last place I worked, though, was for the Oregon Scottish Rite Clinic's Kid Talk program for 12 years, backing up Karen Aguilera, doing the fundraising and all that fun stuff. So I feel very fortunate to be in this position. I really like the work, and I know all the great work that you all are doing out there with the little kids and adults and everybody who needs your help. So we're really happy to be here today. And so I don't know if you want to ask me the questions or if I should just run through them. But
Yeah, so I think I'll ask you the questions, Erin, and then if you can answer them. We have received some questions leading up to our live stream today, and so we've prepared those in a document, but please continue to post your questions as a chat on the YouTube page. Looks like that's getting, the Facebook users are being directed to the YouTube page, and you can put your comments in there. We've got a couple of questions that have already come through that way. Please continue to ask us your questions. So one of the questions that we have received quite frequently is, can SLPs do telepractice in Oregon? What about speech language pathology assistants? And where do SLPs need to be located and licensed in order to serve their clients? And so that question will be for Erin.
Okay, so we recently convened in the last year or two a telepractice committee that several of you were on, and we appreciate your work on that. And that group, we did come up with rules that the board approved about a year ago, and which state that all of anybody that's doing work with children or people in Oregon, any Oregon clients must have the Oregon license. But in addition, if you're working from Oregon, you also have to have the Oregon license. That is not necessarily true in other states, but it is true in Oregon. So if you're sitting at your house working with someone in Washington, then you're going to need to have both the Oregon and the Washington license. And the new rule that we made, we also did rulemaking around SLPAs this year. So we are now allowing SLPAs to do telepractice if their supervisor, who is the case manager always, by the way, if their SLP supervisor has decided that that particular student or patient is appropriate for telepractice with this SLPA, then they just note that in the record, and the SLPA can go ahead and provide services through telepractice. Obviously, they wouldn't be dealing with medically fragile folks anyway, but it's really up to the SLP to make that decision for each and every student or patient on their caseload, and all of them are obviously going to be different. And as long as it's being noted in the record and your reasoning for it, it's absolutely legal now under the new rules. The one area that isn't, however, is clinical fellows. Clinical fellows need to be on the ground in Oregon. They cannot do their fellowship from New York into Oregon. As well, their supervisor actually also has to come into Oregon to do the direct supervision each segment of the fellowship. We have recently run into some clinical fellows who were getting 100% of their supervision by telesupervision. And ASHA does not allow that yet. They may in the future, but there are these 3 little boxes at the bottom of the form where you have to disclose whether or not you've gotten arrangements in advance with ASHA and approval in advance. And ASHA will approve it if you're really remote, such as, maybe Lakeview or, Wagon Tire, Oregon or something, but they probably would not approve it for anybody in the Willamette Valley, certainly, and certainly not in Bend or any place like that. So if anybody is going to be hoping to get telesupervision for their clinical fellowship, they do need to get ASHA to approve it in advance and present the board with that information. So that was something we've run into lately that we didn't know was happening. But other than that, everybody's free to do telepractice, and I recommend that everybody listen to this presentation and get all the resources they can, because I realize that I think it's only about maybe 10% of our licensees that are currently doing telepractice. So there will be a learning curve, and everybody's responsible for their patients, their students, and the technology, and everything that's going on in the session. So everybody should educate themselves about it.
Thank you so much for that answer. I have a follow-up question related to that. So one of the folks that's on our live stream asked about if there's anything that's specific to SLPA documentation that has to occur if they're providing telepractice services.
Well, the new rules simply require you to keep a log of your monthly meetings that you're holding and any other supervision. And so we're really trying to drive everybody back to the student or patient record. That's where it needs to be noted. That's where the SLP supervisor needs to sign all of the notes from every session and review what's going on with their students and patients. So no, we're trying to cut down on the paperwork, and the old supervision logs was kind of asking people to do kind of double paperwork in a sense, because if you're doing all your record keeping according to our record keeping laws and rules, then all of that would be in there and it would be noted. So there's no special thing other than to note it. And also with telepractice, part of the new rules is making sure that the patient has prior notification that they will be receiving services through telepractice. And I know one thing that people were concerned about is whether or not they could turn that down, whether they could say, no, I refuse, or a parent could say, nope, I'm not going to allow my student to have telepractice. But in the case of the schools, the IDEA team, the IEP team can overrule the parent in any event. And our rule currently states that federal law, unless by federal law. So that's the out that the schools and the school-based folks have in terms of saying, I'm sorry, that's really the only way we're going to be able to get services to your child because of where you live and what our circumstances are. And so they can force them to do it. But the whole idea here is just to have notification so that everybody knows what's going on.
Great. One of the other questions that's related to some of what you've been talking about, Erin, is that the Oregon regulations state that the telepractitioner is responsible for assessing the client's candidacy for telepractice. Is this still applying during the COVID-19 outbreak? And how should we be assessing or doing this in terms of documentation?
So far, the rules have not been relaxed or changed due to the crisis. We are willing to look at things, and we do have a board meeting May 1st, which will probably be virtual because we don't have any conference rooms available right now anyway, and I don't think we want to get people together. So we would be willing, if people want to write in and ask us to, if they have ideas for reasonable exemptions. But currently I've spoken with the chair and our council, and we are not going to relax any of the rules right now. There are new rules though for physicians, nurses, and physician's assistants due to the governor's proclamation, but that doesn't apply to all of the other health professions. So at this point, we're not going to make any changes. And, if people need to do something different with the student and the parents on the other end, then I'm sure that as long as you document what you're doing, it'll make sense. But I mean, I think as a practical matter, if a 3-year-old is spinning around on the ground and you can't get them to attend to the computer, then you're obviously not going to be able to have the session. So I don't know if that answers the question, but
yeah, I think it does. And I can see that Kira would like to add something. Yeah.
I just was, I guess I think about the way that we provide services, even in a brick and mortar setting, in a traditional setting, is that, I mean, if I think about my experience in the schools, sometimes seeing a student at my table in my room is the best way to provide services. And sometimes that's not going to work. And so I might decide to push into the classroom, or I might decide to consult with teachers, or I might decide to train the team on using a device. I think there's a lot of different ways that we can use our skills and provide services. And in any setting, we are just going to make the best decisions for the needs of our client or the needs of our student. And I think that bridges lots of situations and not just the kind of crisis we're in right now.
Yeah, and I think that also addresses, there was a question on the live stream that just came through that said, are there any guidelines for assessing students for teletherapy appropriateness? And I think, Kira, you just touched on that. There really is our clinical judgment. We have to determine who are the best candidates for telepractice and if that works for the clients and the students that you're going to be seeing. Okay, so the next questions I'm going to open up to our entire Telepractice Advisory Committee. Erin, please still engage with us, comment from the board's perspective as well, if there's anything that we're touching on that you feel like you would like to add to. So some of the general questions that we've received are things about hardware and software. So just kind of the basics of how do I get set up for telepractice? What hardware do I need? And what software platforms are best? What do we all use? What do you have recommendations? And then we also received a very specific question from a clinician in Oregon who says, who asks, can my clients use iPads or tablets? My concern is that parents currently are needing their computers for remote work at home. So my students may not have access to a computer. So will it work with other types of devices?
I'll speak to some of those issues. I think obviously one of the most important pieces for teletherapy is that you have a camera. You need to make sure that you have good audio and video, and a lot of that is going to have to do with your bandwidth. There's a lot of information out there right now on making the most of the bandwidth you have, but I always recommend that when possible, you're hardwired into the network. Our Wi-Fi in most places is really great and can support good video. But when in doubt, or if you're having issues, I always tell people to look for a way to actually plug into the internet with a cord attached to whatever device you're using. And sometimes that takes a little bit of planning. It might not be possible right at this second when you can't pop out to Office Depot or wherever you need to go to get your supplies. There was a second part to that I was going to comment on.
So hardware, you mentioned having a camera. Anything else? I mean, I'm using a laptop right now.
I'm also using a laptop. I have in some settings used a tablet. There are lots of platforms that have an interface for a phone or a tablet, and that can be a really accessible way for families to get on. I've also heard from OTs that it can be really important for them to be able to, that their client has something that can move with them around the house. And so a lot of times, that can be done with a laptop or a tablet or a phone. I guess any of those options for clients also are going to require some instruction and structure. I've had to help teachers understand that it's really important for me that even if I have a student that's on a tablet, I need them to be sitting in a chair with their feet on the floor. I need them to have a surface in front of them that, setting a child in a spinny chair holding the tablet is not going to be conducive to therapy, because I can't work that way. And I want them to have the best supports to be able to interact with me. I'm sure other people have some input there. Go ahead, Jenny.
Yeah, I would just add, especially in the times that we're in right now, is that often you feel like you understand the setup that your client or the student or your patient might have, and those can change from session to session. So when you're lesson planning and you're thinking that someone's going to be able to have multiple tabs open, or they're going to be able to have access to an app that they have on their tablet as well, they might be on their phone that day. And often that's a great thing to sort of check in the day of about accessibility. Are they in a new location? Have they figured out sort of what they're going to be using? And I think Generally, that's not a huge issue because people sort of learn a routine. But I think especially now, as everything is very much shuffled, it's not a one size fits all answer. Most everything has a camera embedded into it these days. But again, just be thinking that what you've lesson planned for or tried for one day might be a different parent's house the next day, or a different computer or tablet. And so there might just be some ongoing education that happens with that.
Yeah, great. Thank you. And I have also had experience connecting with clients who are using smartphones or tablets or desktop computers with an external webcam that they've added onto it, or from a laptop. So some of the questions that we've received about, can students or clients or patients connect with a smartphone? The answer from my experience has been yes. I use Zoom Pro as the platform. And so Zoom is accessible on all types of devices. We mentioned, or Kira mentioned earlier, I think that there are lots of different types of platforms, software platforms that you can use to provide telepractice. But it's important to know kind of what the restrictions might be, if there are any, for using that type of software on a phone or a tablet. Emily?
Yeah, I just wanted to, I'm sorry, Jenny.
Oh, I'll come in after you're done.
I just wanted to say that on if you guys have not been made aware, that on the hhs.gov website, there's a new notification around different remote communications, and they outline some of the relaxations around HIPAA compliance due to the COVID-19 outbreak. And I just put that in the chat, but I think I just chatted that to you, Megan, so I can put that.
I'll make sure it gets to the YouTube folks.
And they have a list of programs that they recommend, and Zoom is one of them. I know a lot of people have questions about HIPAA, so I figured I would just go ahead and say that. But it's probably going to be something that they're going to continue to update, but that's what I would recommend people check out.
I just posted the link in the comment thread for YouTube. And one thing that I'll just say on Emily's comment is, when you look at those HHS guidelines, you'll see that things like FaceTime and Skype right now, there are also being allowed temporarily during this outbreak as an emergency measure in terms of HIPAA enforcement relaxation. They are not allowing for Facebook Live or YouTube Live or any public facing platform to be used, including TikTok. So no TikTok telepractice therapy sessions.
I was just going to segue that often the device that you're choosing. So I use Zoom as one of the platforms, and I have the app on my phone, and I'm happy to attend meetings on the go that way. But that absolutely sort of adds on to what Emily was saying and what you were saying, Megan, about HIPAA compliance. And so when we get to those questions, which I know there'll be lots of questions about, there's a lot of information about sort of the risk mitigation that you want to talk to your clients about. So they might understand how HIPAA works in their living room, on their laptop, but maybe not in their phone, in their car. And that's a really different discussion. So it's not always just about that platform. And I know we'll get to that, but be thinking about that when you're looking about devices.
Does anyone else have anything to share about hardware or software? Okay. We will move on to our next questions then, which are some user questions. So Erin answered our question earlier about, can SLP assistants use telepractice? And the short answer is yes. And then we also have a question about, what is a telefacilitator or e-helper? Who are these people? What do they do? And can parents or caregivers be trained to be this person for the client or student or patient that you're working with?
I'll just go from a private practice standpoint. I think we can all add something that's a little bit different. In our setting, we typically, how it works in our clinic is that our clinicians are based in our clinic, and they'll be streaming to a house. We see both pediatric and adults. And so, how that works sort of naturally is who's available at home and for what purpose. Generally, we don't call them e-helpers. We don't have any of that terminology. We don't have assistants. So that really is depending on the age of the child, or if it's parent intervention. Often there might be some setup involved in the parent, but for our purposes in private practice, that's not, it's not really relevant to the way that we model. It's sort of that direct service type setup.
I can talk a little bit more about what this looks like in the schools, but I'll preface it by saying that right today, nothing looks like it did the way we were doing things in the schools. So I think that those terms telefacilitator or e-helper are used frequently in school-based settings. And typically that would be the person who might get the session started, might get the students from the classroom and make sure they're in the right place. They might be able to shuffle papers or make sure that supplies are there. If there were things that needed to be printed out before the session, that person could do those kinds of things. If students are at home and school-based SLPs are possibly going to be reaching out to students in their homes, there is not an e-helper or a facilitator there. You're working with parents or siblings or aunts and uncles or whoever's there. So it really then follows much more of the private practice model. I think you're taking advantage of whoever knows how to get on the live stream and giving as much support and training you can to whoever is open to taking it.
Which also means you want to be very comfortable with the platform that you're using. You're going to want to trial it ahead of time, probably before you start interacting with parents. So because you want to be able to debug with whoever that person is, how you turn the volume on, how do you turn your video on and off, how do you chat? And so you're going to want to be able to do that. So you have to be able to navigate somebody else when you can't see their computer. So just to tag onto that is that if you're working with different adults or yourself, you're going to really want to be comfortable with the platform.
And I will say, as an add-on to that, Jenny, that a lot of platforms, it might look one way on your laptop screen, but if your client is using a tablet or a phone, the buttons might be in different places. The controls or the setting buttons might be accessible in different ways, and it's worth just playing with that a little bit because as especially being a provider going into somebody's home, you're really you're the therapist, but you're also the IT provider and the counselor and everything else. And so it's okay to say you don't know, but it's worth having just a couple strategies, even if it's let's hang up and try to reconnect. But good to have some strategies for that.
And Emily, do you want to talk about parent involvement in terms of setup? I know you work with little bitties.
Sure, yeah. And on the projects that I work with parents, with parents, we troubleshoot using Zoom via an iPad, and we also use this other sort of remote controlled iPad stand called a Kubi, and that allows me to control the angle of the video. And so I just walk parents through each of how to troubleshoot with Zoom, how to open the application, what to do if they can't connect with me. And so far, all the parents that I've worked with have been able to, with my support, troubleshoot using that platform. Although that does require a pretty extensive knowledge of how the application is working on my end so that I can explain to families how to do that and how to join a video meeting in multiple ways if for whatever reason they've forgotten their login information or what have you. So I've sort of developed a procedure to help families through that and share that with them as we're starting telehealth sessions. And I always provide my cell phone and my office number so that people can just call me and I can try to walk through things with them. And I would highly recommend that. And so that you have a way to contact families in the midst of troubleshooting.
Yeah, I think two things really stand out to me from what y'all have mentioned and what we do in my lab, which is to really explore the platform that you're using, whatever that may be, so that you know it backwards and forwards, and you can provide instruction to folks who are connecting to it for the first time. It might also be helpful to maybe make yourself a quick tips and how to navigate to different things within the platform, and you could share that with your families or with the clients that you're working with. We have kind of like a checklist of a manual in my lab for Zoom, using it with different types of hardware because it does look a little bit different depending on if it's a tablet versus a computer. And the other thing that I was thinking about is having access to your phone. So sometimes folks do just need to be walked through the steps to setting it up for the first time, whether it be for actual troubleshooting problems or just because it's new and they want to hear your voice as you're walking them through it. And that can be a really effective way to help your clients get onto a new platform. So I'm going to transition to school-based questions right now. We've received quite a few of them on the YouTube live stream commenting. And then after that, we'll move into insurance. So those of you who have questions about insurance reimbursement, don't worry, we're going to get there. We're just going to head to the schools first. So let me pull up some of the questions that we've received. So let's see. One of them was, sorry, just have to scroll to see it.
The suspense is killing me, Megan.
I know. So Kira, for school-based SLPs, this might also be a good question for Erin. During this emergency closure, if we switch to telepractice, do we need to revise the services summary on each IEP to reflect it?
Well, I can give an answer. Erin, you step in if you would answer differently. I would say no. In the IEPs that I write, I don't actually specify that the service is provided by Telepractice. I don't feel like it's a different service that kids are getting on their IEPs. I definitely make sure that parents are aware that services are being provided by Telepractice if I'm starting at a new school, but I don't feel that it's necessary to change the IEP. I'm providing the minutes as they're specified on the IEP. That said, I think that services, if schools are to be providing them right now, at least initially, might not look exactly like they're written on the IEP. And I don't know what the official stance is on that, but I think there's going to be some level of understanding that it will take time to get everything running.
This is
Did I
Erin.
answer the question?
Hi. I actually don't really have a comment. This is Erin, because ODE would really be the place to go to answer all those questions.
And from our understanding, every district is handling things differently right now. Kira, would you like to talk about that just kind of briefly?
Yeah, I mean, it's an easy answer, is that there's not really a across the board answer for how districts are proceeding. We work with districts in 5 states, I believe, and there really isn't a pattern. There are some districts who were prepared right when schools closed to turn around and start offering services online. There are other districts who are just now kind of planning for, I've heard the term remote learning a lot. And so I think that could include everything from putting packets in the mail to providing phone consultations to families to setting up video meetings with students and families. And then there are some districts who really have not made any plans yet. And I think the best guidance is to listen to direction from the state and from your district. But even in districts where there's no plans, I'm telling people, think creatively about what you could possibly do if this goes on longer than we expect.
Great, thank you. Someone has a related question about this. So Barbara asked, with the coronavirus closing schools, can telepractice be used to offer services even if all students are not able to access the services?
What a great question. Mm-hmm. Yeah, I think that is the question of the day. My personal opinion is that we need to be able to provide services to all students. but it might be that we have to start somewhere by providing services first to people who we can access, and then start working on kind of our tougher cases. I don't have a great answer for that.
I think it's just evolving. I mean, it's something that I think if you're a practicing clinician and you're in this situation where you feel like some of your caseload you could still continue to see online, but there are other folks that you wouldn't, either they're not appropriate for telepractice, or maybe they don't have access to the internet, or they don't have a device that they can connect with, that you should talk with your school-based administrators and ask them for what that district's plan is for working with those families and with those students. Let's see. Someone else also commented on the YouTube video that they are a special education administrator, or they're attending a special education administrator meeting tomorrow about IEPs. And so it looks like, you know, folks are saying there will be more guidance coming from other places about that too. So I know that ASHA is also working really hard to get out information to members as quickly as they can. Someone asked a question about, shouldn't FaceTime be similar in privacy to making an audio phone call? The privacy protection, yes, but typically FaceTime is not approved in terms of HIPAA compliance for because of encryption protocols. And so, but right now, as Emily mentioned, and as our link that we shared in the comments says, the Department of Health and Human Services at the federal level is relaxing some of its HIPAA enforcement during this time.
So I think, Megan, that that FaceTime is not technically HIPAA compliant because they don't offer a BAA,
right.
But that you know, for practice in the schools where you don't need a BAA, that the encryption of FaceTime would otherwise be sufficient for that. The other limiting factor, though, is that it only works. It's only encrypted in the same way if you're talking from an iPhone or an Apple device to another Apple device, and that can be limiting for participants.
Oh, wow.
Thank you. So let's move into insurance and reimbursement and billing, all of the hot topic questions. So first, I'll just ask, does insurance reimburse for this? What advice do you have for folks who are looking for insurance reimbursement?
I can jump in if you'd like. So just a reminder, we're in the state of Oregon, and every state, if anybody's paying attention from another state, every state is very different. But yes is the answer, but it's very specific to your payer source. So I'm going to give anecdotal information that you would always want to verify or have your clients, whomever you're working with, verify. If that's sort of the direction I think, Megan, that we're going to go. So in the state of Oregon, we currently have, there's already been changes to this, but in general, we often see our clients at the clinic with plans from Blue Cross Blue Shield have reimbursement for online speech services, and MODA as well. Now, every plan is different, even within an umbrella of Blue Cross Blue Shield. And so we always put the onus and the responsibility on the individual plan consumer to verify. And part of that is because if you've been calling insurance even before all of this has happened, you are really subject to whoever is answering the phone. And sometimes you get an answer that's one, and then you'll call back and you get an answer that's different. And we really want to acknowledge that we do our best to verify benefits, but if you're the provider, you want your consumer, client, patient to understand how to navigate that. Recently, the good news is that OHP now reimburses for telehealth, and that's just brand new as of like a couple of days ago. And that's amazing. It's certainly in the Portland metro area. Our Oregon Health Plan clients are perpetually underserved, and so this is phenomenal. There are other, Kaiser has their own telehealth program built within the Kaiser system. They don't currently let subcontractors provide that, but it's anticipated that there's a possibility. Again, you always just want to have them call the number on the back of the card, and I can even give you those codes if that's of interest. think it might be. What do you think, Megan?
Will you chat those codes to me and I will make sure that everyone has access to them?
Yes, I will. All I'm going to say is that your CPT code, that's what you're doing, is going to be modified with the modifier GT, and I'll send this information. And then there's place of service codes. So when I call an insurance company, I don't ever actually say, do you reimburse for speech services online? Because the person answering the phone has absolutely no idea. But if you say, do you use this modifier with this CPT code? They just look it up and they can say, yeah, we take the GT modifier with 92507. And then that's all the answer that you need. And you'll then proceed. Often we tell clients at our clinic, we think so, we're going to bill it. And then do you want us to like wait a week or two or however long it takes, sometimes months, to get reimbursed before we continue? Because if not, you're on for that. But we have those conversations ongoing. So you're going to look for a modifier and a place of service code. Usually it's 02. ASHA says 95. I haven't come across any insurance provider that uses 95, but I will get those to you. If there's specific insurance information, I will try to answer those questions.
Great. And one of the questions that we received leading up to this conversation was, will OSHA or ASHA provide a comprehensive list of all of the companies that cover telehealth? And the answer is we just can't. There's so many variations between large company policies, individual family policies, what's accepted and what's not. And we are in a state of constant change right now. And so any information that we provided today would most certainly be outdated by tomorrow. So just what Jenny suggested, checking in with the insurance companies, both as you coming from as the provider, but then also having your clients or their family members, caregivers, partners call and ask their insurance companies as well.
And additionally to that is that you would need to understand in-network and out-of-network benefits, and you would need to be in-network. Generally, if they cover it in network, they will also cover it out of network, but it really varies. So they might cover it in network, and if you're not credentialed with that insurance panel, it is just sort of a host of mess, as insurance often is. So the good news is that this is going to certainly push a lot of the companies. So Medicaid is now doing it, and again we have the OHP, which is brand new. So I think that's the 101, insurance 101, although it could be a lot longer conversation.
And one other comment that some folks have made is, well, isn't Kaiser doing telepractice with their clients, and isn't the VA doing telepractice with their clients? And the answer is yes to both of those questions, but both Kaiser and the VA are their own insurers. So they kind of play by different rules. I just saw a comment from Leisha on our YouTube page that says, we were told by Kaiser as a community partner that we were allowed to use our own Zoom platform. Things are changing daily and hourly.
When did we get that information? I would say.
And of course, OSHA is working really hard to advocate for telepractice coverage with our Medicare population. We have a bill in the Oregon legislature that will not be discussed until next year when we have another session, but to approve telehealth and telemedicine as reimbursement with Medicaid, Medicare. We are also working with ASHA OSHA is working with ASHA to continue to lobby for telemedicine, telerehabilitation, telepractice reimbursement. And I'll share a link with you all to a letter that ASHA just sent today to the House Speaker, Nancy Pelosi, in favor of a bill that is being discussed related to telepractice reimbursement. So there's a lot of movement from our advocacy agencies, from our professional organizations. We also encourage you to get in touch with your representatives, your congresspeople, and talk with them about the need for telepractice reimbursement now. Okay, let's see what other. So there are some questions about, do we know if Medicare is reconsidering? We sure hope so, and we will let you know as soon as we have more information about that. As I mentioned, ASHA is pushing really hard for this, and OSHA is advocating at our state level as well. Okay, so some of the questions, we're going to shift from insurance and reimbursement now to how do we work with, there's several folks who have commented about early intervention, working with kids at home, and how do we do this? What are some best tips or strategies? And I'm going to ask Emily to chime in on this. This is her area of specialization.
Sure. So tips for early intervention, I think the best tip that I can give is to try to first sort of help your families understand what's going to be different about the visit now that you're providing it via telehealth, telepractice, and give them a really clear structure around expectations. One of the things that I do as part of my research project is I use a model called Teach, Model, Coach, Review, and that's an instructional framework that I use when I'm coaching caregivers to use language support strategies. And so I'm very explicit about how the session's going to go. We have our temperature check where we run through what's been happening in the previous between sessions, and then I just sort of orient them to the fact that, you know, we're going to use this format. We always follow this format where I'm going to teach you something. I'm going to model it via role playing or asking situational questions. So for example, if your child points to one of his toys and reaches and shows it to you, how would you respond? So that might be an example of kind of some role play that I would do. And then I generally move into coaching where the family member is interacting with their child, and I'm giving them performance specific feedback. So I'm telling them really positive things that they're doing in that interaction. And then I try to do that about once a minute for about 10 minutes. And then we have a period of reflection around what happened, what went well, how the parent might practice that strategy in other settings or other family routines. And we make a plan for the next session. Now, in my project, I'm teaching very specific language support strategies, and depending on your early intervention model, you might be targeting more general, we have like two professionals telecommuting right now. Yeah. I'm so sorry. But essentially have a period of reflection. I'm using very specific language support strategies as part of this prescribed intervention, but whatever you're focusing on with the family, you can use that same format. But because for most people, they're not using telehealth, telepractice regularly like I am, I would sort of make an outline for how you think you want your session to go ideally. I would give yourself some time to troubleshoot the technology, and I would use humor to kind of make it easier for a family if they're really struggling. And I always use the example that I'm a flip phone user. I actually am. This is my official phone. And if I can be a telehealth interventionist, any parent that can text on an iPhone can do this. And so I just try to make it light, keep it light, because the technology piece can really fluster some families. And so I make sure that I have time for that. But I really try to use a prescribed outline in my session. And my intervention is parent implemented. So what I'm really doing is I'm giving the family the capacity to increase their child's different developmental skills. And when I'm in the home, I'm still using that same format. So it's more similar. My sessions are really similar. It's just the service delivery method that's a little bit different. So I understand that might be harder to adopt if you're for the first time starting a tele sessions. And I can share some resources if people want to email me directly about what I have like a checklist that helps me walk through that framework. If that's something that makes sense for your setting, I'm happy to share that Teach, Model, Coach, Review framework. Yeah, I think that's all I want to say about that, but I'm happy to answer more specific questions if people want to reach out to me.
I had just a couple of things that I thought of while you were speaking, Emily, that could be relevant to clinicians who are thinking about taking a traditional model and now trying to see those same preschoolers online. I would challenge people, I guess, to think about it in terms of what accommodations kids need to be able to participate in therapy. And maybe there are things that you could walk a family through. Again, if you're working with families who didn't really sign up to do online therapy, there might be, bigger challenges. But I think, sometimes you might look at things like, can you make sessions shorter and more frequent? Or could you, do more parent coaching or caregiver coaching and less direct intervention? Or could you, change the location in the house or take away distractions or kind of some of those other just creative ways to accommodate your therapy.
I also wanted to share really quickly so people can see the Early Childhood Technical Assistance Center, for those of you who are working in early intervention or early childhood settings, has created this add-on page around responding to the coronavirus COVID-19. And if people have questions, there's some really great literature that's been posted to this site. And I put a link, Megan, in the chat box. If you can share that on live and on Facebook, that would be great. But the Tech Act Center has some really, really great references. And I also just want to highlight for people that are in early intervention who are new to that setting. Colorado has some really great, let me pull up the specific. It's the University of Utah's hearing intervention program, and I will pull that up. But they have some really great, they have 3 web videos that walk through preparing a family for telehealth telepractice sessions as a professional preparing for telehealth sessions. And I'll put that in the chat box too. That might be a great freely available resource for people in the early intervention setting.
Excellent. Thanks so much. And I know folks are commenting, asking for our contact information. I'll make sure to end our session today with a post that has our emails so that you can get in touch with any or all of us as you're working through this for yourself and for your clients. Let's see. So there have been a few questions about how do you assess if a child is or a client is appropriate for telepractice? What do you do? We talked about how it's clinical judgment. There really isn't kind of a standard checklist that you go through and say, yep, this is a person who can be seen by telepractice. So would y'all want to touch on just some of the things that you feel like are important to be thinking about in terms of who's appropriate for telepractice? Yeah, Kira.
I actually just sent you a link, Megan, that maybe you can post in the chat section. It's a link to a download that's available on the Hello Foundation website, and we actually do call it a checklist for telepractice. It's not really maybe as simple as that, but it it's designed for teams really to look at together, but it looks at physical considerations, cognitive and behavioral considerations, and communication considerations that are important for participation in a telepractice session.
I would just add to that, that what we use to consider appropriateness, I always sort of stress to clinicians is just to consider all of the clinical hats that we wear. And Emily has really touched on this, and Kara and Megan, that, as clinicians, we one-on-one service or group or small service is only one of the many things that we do. We do case management, we do collaboration, we do assessment and screenings and problem solving and lesson plan. We do all of these other things. And telepractice is not a one-size-fits-all service delivery method. And that when you're thinking, especially in these times, of how in the world am I going to provide service or judge who and who does not get services, be thinking that we probably have something to provide every single family or child or adult that we serve in some capacity. Will it be as relevant to, when you're looking at an academic educational impact? Those questions might be a little bit different right now. But if it's, do I have some expertise, advice, knowledge, service goals so that I can provide a family in these times? The answer is probably yes, you do. And it might just be a little bit different than what you're envisioning. And so really sort of explore that. Is it a goal that you're going to target? And is that going to be difficult on telepractice? Yes, it very well might be. But is there an element of that that you're going to get through the next 6 weeks or several months that might be really beneficial when a family is like, how do I modify these assignments that are coming in from a classroom teacher? How do I work on sensory? How do I work on behavior when if you're like me, I live in a small apartment with my kids. Those are things that we can absolutely help with. And so be putting your clinical hat on when you're thinking about appropriateness.
And as a related question, thank you both for your answers there. And so I'm going to ask Erin, there was a question that came through that said, if there are clients that are not appropriate for telepractice, then I'm wondering what the board of speech language pathologists and audiologists in Oregon would say about how we can equitably provide services online during school closures.
Well, I think that like you say, you're going to have to be creative. I think that you could obviously work with the parents as best you can to do carryover activities and try to, see what they can do if you cannot get the child to attend to the screen or to the technology. And you're just going to have to be flexible, I think, and creative and go from there. That would be, I guess, my answer.
Thanks. And there's one more. Oh, sorry.
Well, I was just going to say, and remembering, I think that equitable doesn't mean the same services for everybody. And so there's going to be different solutions for different families.
Mm-hmm.
Yeah, and we've absolutely worked with kids who have voice output devices or who work with AAC or there's a wide variety of the services that we provide. And as you're learning this model, if you're new to it, the answer might just be, I don't know yet. And so if you're making a decision about whether a child or an adult gets services or not based on your lack of knowledge, reach out to us, reach out to other people, how they're problem solving, because I guarantee that someone on your caseload looks like somebody else who's trying to deal with that same thing. And there's a lot of workarounds, even if it's consulting, having a specialist Zoom in as well with permission. There's a lot of options out there. And so seek answers.
Thank y'all. One other thing that I think we'll try to address, and then unfortunately we're running right up to 5 o'clock. And so we'll address the question of group therapy last, and then we'll close out this session. Feel free to continue sending us your questions. If there is enough of content or additional questions left, we'll talk together about maybe having another kind of session 2 or continuation of the conversations that we're having today. Thank you all so much for your input and for this dialogue that we're having online. So one of the questions was, can you do group therapy via telepractice? And the answer is yes. This is part of what I do in my clinical research, and we see clients who stutter in group therapy. Almost all of our clients receive group therapy. The way that it works is that when you are sending out the link to your client, you can send out that same link to other clients as well. And then you end up like this, just like what Jenny's showing. And this is how group therapy looks. So each client in their own box, but they can see each other, they can talk with each other. You as the clinician can facilitate interaction amongst the various clients or students or patients who you're working with. I'm most familiar with the platform Zoom, although I think many platforms have similar functionality. So Zoom has a chat function on the side. You can select who you're chatting to. So if you're working with school agers or adults and you're in the group setting and you want to send information just to that child or just to that client, you can do that. You can also have them, just as we're doing, take turns in talking. You can share your screen, just like Emily demonstrated for us earlier, to pull up materials that you'd like to talk about, or some type of cool video to show your students or clients, or an online book that they might want to see or read. Really the possibilities are endless. So group therapy does work via telepractice, and I think it can be a really wonderful solution for us navigating this this right now. So I think because we're right at 5, I will go ahead and and close out our session. Thank you, Emily, Erin, Kira, and Jenny for being here and for sharing your expertise with us and with the OSHA community. I'll make sure to share our contact information. Please don't hesitate to reach out to us or to the OSHA board in general or to the Oregon Board of Examiners. We're here to help as much as we can in this really unprecedented time, knowing that things are changing all the time. So be safe, be healthy, and we will be in touch and let us know what questions you have. Take care.
Thank you for facilitating, Megan. You did great.
Sure.
Bye. Thanks, everyone.
Thank you, everyone.